What if I told you that over 120 million Americans live in a healthcare desert? That means 1 in 3 people in the US struggle to access basic medical care. Things like filling a prescription, getting a checkup, or traveling to a hospital in an emergency.
We're so far out from a big city. The closest specialist for the autoimmune disease that I have to go to UCLA Medical Center in Los Angeles. I used to have great insurance, and I was able to go to the Mayo Clinic in Scottsdale, Arizona 4 times a year, which was great. But then I lost my health insurance and wasn't able to see, any kind of a specialist. Another challenge is getting my prescription drugs. I will actually call my prescriptions in, a week or 10 days prior to them running out. And because of my insurance, they say, well, we can't fill those yet. And then by the time I'm out, then the pharmacy doesn't have my medication yet.
It's not just about having hospitals and clinics. Healthcare access is shaped by where you live, how much you make, whether you have internet access, and a whole lot more. So what exactly is a healthcare desert, and why do so many Americans live in one? In an ideal world, you'd have a pharmacy nearby to pick up medications easily and affordably. You'd have enough primary care providers to see a doctor when you need one. If you need urgent care, a hospital or trauma center wouldn't be more than a short drive away. And if you're uninsured or low income, a community health center would be within reach. But for millions of Americans, that's just not the case.
Round trip is 105 miles to get my medication. You need to call 911. It takes 45 minutes to the ground ambulance to get here. It takes, a half hour, 45 minutes for the helicopter to get here.
We have a massive area, and some of these places don't have an ambulance at all. The furthest I've driven is 140 miles to get to the patient. That's not including the 140 back. And if that patient needs to go to a higher level care of hospital, that's probably including an extra 330 miles round trip.
Research shows that over 80% of U.S. counties lack adequate healthcare infrastructure. 45% of counties are pharmacy deserts, meaning a simple prescription refill could be a long drive away. 7% of counties don't have enough primary care providers to meet demand. 20% of counties are hospital deserts, where the nearest hospital is over a 30-minute drive away. 40% of counties are trauma center deserts, where people have to drive over an hour to reach critical care. And 41% of counties lack nearby access to low-cost health centers, places that provide essential services to uninsured or low-income patients. And these gaps don't exist in isolation. They stack up on top of other barriers like income, internet connection, and insurance. Let's break it down. First, internet access. In today's world, you need internet access for almost everything. Researching medical conditions, finding a doctor, even booking an appointment. But states with the worst healthcare access, like North Dakota, New Mexico, and Mississippi, also have the lowest rates of internet access. And the group most likely to lack internet? People 65 and older. The very people who typically need healthcare the most. Then there's income. U.S. healthcare is expensive. Nearly 1 in 3 families report skipping care because they can't afford it. In places like Montana, Idaho, and Tennessee, where household incomes are lower, healthcare deserts are even more widespread. Paying for your healthcare goes beyond covering a medical bill. You need a mode of transportation and possibly the ability to take time off work. If your nearest healthcare facility is an hour's drive away, seeing the doctor might mean losing an entire day of wages. And finally, insurance. In states with high uninsured rates like Texas and Georgia, people are less likely to seek care. That means worse health outcomes, more emergency visits, and higher medical bills.
Interestingly, ranch owners and farm owners, a lot of them are self-pay. A lot of them are taking that risk of avoiding something catastrophic and are willing to pay out of pocket for their care. I certainly am always looking into resources for patient assistance programs, or, this is a self-pay imaging facility or a self-pay laboratory that will give you a cut for cash so that they can still access care, but not break, the bank doing it.
And just because you have insurance doesn't mean that everything is covered. including for people on Medicare. Look at the delta between 2010 and 2025. In 2010, 73% of prescribed medications were covered by Part D plans. As of 2025, the numbers dropped to just 56%. So that's more and more money coming out of their own pockets. And 1 in 5 of them live outside of traditionally urban areas. So the impact of that lack of coverage surely compounds for that population.
So, what can be done? The good news is that small changes can have a big ripple effect. Expanding Medicaid in all states could bring more hospitals, while also slowing down hospital closures, particularly in rural areas. Investing in mobile clinics can help reach remote communities. Programs in states like Texas and West Virginia have already shown success in delivering preventative care and screenings to people who would otherwise go without. Strengthening telehealth programs could be a game changer for those in internet-poor areas. Initiatives like broadband subsidies or partnerships with public libraries could provide new ways for patients to connect with healthcare professionals. Bringing pharmacies into underserved communities through incentives and grants could help reduce pharmacy deserts. Cities like Chicago and Baltimore have experimented with pharmacy sharing models and independent dispensaries to bridge the gap. So if we know what needs to change, why is access to healthcare still out of reach for so many?